you needed a dental cleaning? No problem, I can do that for you. My name is Sarah, and I'm going to be your dental hygienist today. So let me just get on my gloves really quick. And are you having any sensitivities or problems or issues with your mouth? Okay, just a little sensitive. Can I ask what toothpaste brand you use? Colgate. So usually patients with sensitivity, I recommend using Sensodyne. That seems to help people a lot. No problem. So just to start, I'm going to go ahead and feel around your jawline. So I'm just going to have you just keep your mouth relaxed, your jaw relaxed. I'm just going to feel here. I'm just feeling for any abnormalities. And then I'm going to have you clench your jaw for me. I'm just going to feel again. And I'm just going to tilt your head a little bit up here so I can feel below too. Okay, you can tilt your head back down. Okay, I don't see anything wrong with that, so we're going to move on to the actual cleaning, okay? So first, I just want to get an initial look into your mouth so I can check to see if I see any cavities or any teeth that could be problem areas. So I'm just going to have you open your mouth for me. Okay. Good. I also have my mirror here and I'm just going to be looking in your mouth here. Look way in the back here. I don't see anything. So I do want to take x-rays. It looks like you're due for an x-ray. So we're going to do that really quick. So this is our x-ray machine. I'm going to go ahead and just place this on the side of each of your cheeks. I'm going to have you smile when I tell you to, and then you'll just hear a click. And that's the sound that it took the picture. So go ahead and smile for me, and you're going to hear a click. Good. And smile for me. Click. And go ahead and smile for me. Click. And last one, go ahead and smile for me. Next thing that I'm going to do is I'm just going to go ahead and count your teeth to make sure that you have the correct amount of teeth. So I just have this tool here. It looks very sharp, but don't worry. I'm going to be very gentle and careful. keep an eye on it for now. It's just a little bit. It looks like it's growing in the way of another tooth. This tool here again, the other side, to just scrape any plaque off, so your teeth are shiny and clean. Don't worry, it won't hurt too much. Sometimes it can aggravate the gums, but it looks like you brush really well, so. Okay, so go ahead and just relax for me. Scrape that out. Are you doing okay? Okay. You are bleeding a little bit. Get you some water to spray in there. Go ahead and swish that around for me. And when you're ready, you can go ahead and spit. Great. I'm finishing the top here. Move on. You don't have too much black. Move on to the bottom now. I'm gonna just spray this in your mouth here. Go ahead and swish around for me. And go ahead and spit. Good. Can you open your mouth a little bit wider for me? I'm gonna turn your head this way so I can get over here. Thank you. Okay. I'm gonna turn your head the other way here. And just go ahead and open as wide as you can. One more water swish here. Just gonna spray it all in your mouth. Go ahead and swish for me as best as you can. And then go ahead and spit. Perfect. You're doing so great. I just have a few more little spots to get to have some buildup on it. I'm not seeing any cavities, so that's good. How often do you brush every day? 2 times a day. That's great. And do you use any sort of fluoride? Okay, good. Yeah, your teeth are looking really great. And everyone's gums bleed usually, so I wouldn't worry too much about that. Okay, so everything looks great as far as I can see while I was cleaning. So next I'm just gonna brush your teeth here. So I just have a toothbrush here, and we're just gonna brush really well here. What's your plans for today? Yeah, it's beautiful out. Going to the beach sounds so nice right now. It really does. I think it's supposed to reach 70 next week. Do you go to school at all? Or do you have work? School? What are you going to school for? Oh wow, that's ambitious. Go in the back here really quick. You're doing great. Again, just saw one tooth that could be a problem. Might have to pull eventually, but for now, we'll just keep an eye on it. And I did look at your x-rays, and everything looks great. Okay. So the next thing I'm going to do is just floss a little bit. Do you floss every day? At least you're honest. Flossing is just one of those things, you know? But it is really important for your gum health, so I would recommend it. Sure, yeah, I can give you a demonstration how to brush and floss properly if you would like. Yeah, a lot of people don't know how to brush or floss properly, so I will do that after we're done here. Alright, let's get the bottom here. And for your fluoride, do you prefer mints? I think we have blueberry, mint, or bubble gum. Bubble gum? Okay. Usually patients pick mint, but bubble gum's like the second favorite, I would just say. I'm going to apply some fluoride with this sponge here. So I'm just gonna have you open. Just gonna apply this, and we just recommend you don't eat or drink for the next 20 to 30 minutes. It's not too long, but hopefully you ate before you came here. This pretty simple. If you open up a little bit wider for me, thank you. And I'm gonna open up one more time. I'm just gonna make sure I got everything here. Just a few spots here. Just gonna fix that. Are you doing okay with the fluoride? Yeah, sometimes it can taste gross. I can't give you any water just because it will all rinse out and it will defeat the purpose. Alright, I'm just gonna check once more with this flashlight here. Making sure I have everything. Don't see any plaque left. I don't see anything else left. Hippopotamus dude here. And I'll just show you really quick. So to brush, I'm sure you know this, but just start. Actually, usually I recommend people start in the front here, the bottom teeth, and just brushing in circles like so. We'll take these off. So just brushing like this, and then we'll reach the back here. And these teeth, a lot of times will get cavities, so you want to make sure you brush those really well. And then you want to make sure you get the back as well. And then same with the top. I'll just brush the front here, going all the way to the back. And then brushing the inside. It's kind of a bad demonstration because it's hard to do on there. How's the fluoride feeling? A little bit sticky? Yeah, that's completely normal. It will eventually go away. And in 20 to 30 minutes you can drink and eat and stuff, and that feeling will completely go away. I think we're all set here. Do you have any questions for me? No? Okay. Well, thank you so much for coming in. I'll go ahead and give you a card for the next cleaning in about 6 months, okay?